The health reform legislation moving through Congress could increase the federal deficit by $1 trillion over the next 10 years. And the director of the Congressional Budget Office testified the legislation would increase, not decrease, federal health care spending. Even so, this is not universal care. The plan would leave 17 million people uninsured. The proposal would require everyone to purchase health insurance, and the government would decide which policies are acceptable and which are not. While the final contents of the massive proposal aren't known, one thing is certain: it would forever change health care in America. For example, one section of the proposal describes a computerized ID card that would tell officials whether a patient is allowed to see their chosen doctor or receive their requested treatment.
I think we can all agree that the problem we have with healthcare in this country is cost. So the whole issue is, how do we bring costs down or keep them controlled and yet allow patients to control their healthcare dollars and their healthcare decisions?
If we're able to allow patients to be able to have insurance that was from another state and have coverage that was less expensive, and that the insurance companies had to compete with one another for all of those patients, that the winner in that situation would be the patients.
The other thing we need to do is change the tax code in this country so people, individuals, can deduct the cost of their healthcare expenses just like employers and businesses do today.
I think another solution might be to take those 14 million or so people in the United States who could enroll for government-assisted health care, but have just chosen not to sign up for it. I think the ideal thing would be to encourage them to enroll for these programs when they're readily available.
The other thing we need to do, which no one is talking about in Washington, D.C., is reforming Medicare. We need to allow people to opt out of Medicare. We need to means test so those who are very rich don't need to participate in Medicare. We also need to think about tort reform in this country. Maybe as much as 10% of our healthcare costs in this country are due to attorneys' fees, and most importantly, to defensive medicine practiced by physicians. And by defensive medicine, I mean physicians ordering unnecessary tests just to protect against lawsuits. The most important person in this whole healthcare mess is the patient. The patient should be able to control his healthcare dollars and make his healthcare decisions with his providers. And yet we have bureaucrats in Washington, D.C. who are telling us that they are smarter than the individual patient is. That makes absolutely no sense. We need to put the patient back into the healthcare equation.
Your health is on the line. Learn more. Get involved. Speak up.